Now, it's been called the parallel pandemic. Many people who get sick with COVID-19 develop symptoms that remain long past their initial infection. This is so-called long COVID. Some estimates suggest more than a third of COVID survivors will develop longer-term health problems, anything from headaches to fatigue or more serious conditions. DW correspondent Manira Chowdhury has taken a look at the long COVID situation in India.
Sadhna Tandon calls her pet dog Pepper her lifeline. She says the pup keeps her on her toes all day, something which she says was not possible just a couple of months ago. 63-year-old Sadhna was infected with the coronavirus during the second wave. While her initial infection was not severe, a few days after testing negative, she was diagnosed with cardiac inflammation, a post-COVID complication which left her with a crippling weakness for months.
I used to feel so weak that I would, at times used to feel like I can't even sit, I must lie down. I hardly had any stamina. I was, though, a very active person earlier. And I started feeling depressed also. I used to feel very low.
Sadhna's case is not exceptional. Many other people have suffered from post-COVID complaints, more commonly known as long COVID. A name given to the persistent illness a person feels while facing symptoms or effects for weeks or months after testing negative for the coronavirus. Dr. Ayush Gupta says patients have come to him with complications like headache, fatigue, depression, palpitations, and cardiac issues, among others.
A staggering number, that is 60 to 70% of patients who recover from COVID have these effects on them. There are some kind of risk factors which predict long COVID. Duration of illness is one. Severity of illness is second. It is not completely understood. It is a science in evolution. So even young patients may be experiencing more symptoms than an elderly high-risk patient.
30-year-old Roshni Divakar was an avid yoga practitioner. She says she was at her healthiest stage when she tested positive during the second wave, and her infection was quite mild. But soon after, she started experiencing complications and was diagnosed with a balance disorder called vestibular disorder, which makes her feel dizzy and causes constant ringing in her ears.
It's like being on a boat all the time. So when I stand, the floor is like this. So for me to walk straight is a struggle. There was a point where I literally needed to be lifted to go anywhere because I just couldn't get my balance. It can be very overwhelming and exhausting.
While for Roshni, it has been rehabilitative therapy and yoga that have helped her gain a sense of control over her condition. For Sadhna, it's been medication, ample rest, and her pup Pepper, which helped her with her post-COVID complication.
He sleeps with me, he eats with me, like a small child. I have a grandchild home now.
Sadhna says she is a lot better now as she has found some happy distraction with Pepper. But for many like her, the lingering effect of COVID remains inexplicable.
Let's take a deeper dive with Dr. Lancelot Pinto, who's a pulmonologist at Hinduja Hospital in the Indian city of Mumbai. Welcome to DW, Doctor. We have learned so much about coronavirus in such a short time. Why is long COVID still such a mystery?
Hi, Phil, and thank you for inviting me on the show. I think it began with the incorrect assumption that a lot of it was psychosomatic. So with the first wave, we were in the middle of lockdowns. There was a lot of panic. There was a lot of anxiety all around. So it was just assumed that somebody who got COVID in that kind of a milieu would suffer from psychosomatic consequences. We now know that that is incorrect, thanks to a lot of experts who raised the alarm and said there was something going on, which was not merely explained by a post-COVID situation because of stress. I think it's difficult to diagnose it because of the multitude of systems involved. So it could range from a brain fog, difficulty concentrating, this extreme fatigue that we are seeing, especially with the Omicron wave, to gut abnormalities, to cardiac abnormalities, to involvement of different systems across, which makes it difficult to pinpoint what exactly is going on. I think the third reason why it's been so difficult is because of the various hypotheses as to why it happens. So there is a hypothesis that there are a few viral fragments which stimulate the immune system. There's autoimmunity, which has been hypothesized. There's the vagus nerve, which is a nerve that supplies the different organs of the body, the gut biome. So I think these are some of the reasons why it's been so difficult to kind of quantify and define.
Right. It's so, as you say, just a multitude of symptoms there. So aside from not getting COVID in the first place, is there anything we can do to minimise the risk of getting long COVID?
So given the fact that we don't know too much about it, one of the things that I have been telling my patients is at least make sure all your comorbidities are well controlled. So we know that COVID causes sugars to rise, for example, blood sugars. So I've told my patients with diabetes to make sure that their diabetes is well controlled. Individuals with high blood pressure, individuals with cardiac abnormalities, this is not the time to not adhere to your medications or to experiment. This is the time to be regular. I see a lot of patients with asthma who have their asthma flare up post-COVID, and I've kind of re-emphasized the fact that they need to be very regular with their puffers and their inhalers. So I think that's one of the things that can be done. Vaccination has been shown to have a protective effect on long COVID. So if you've had COVID, you've not received your vaccine yet, this is the time to go ahead and get the vaccine. If you're on the fence wondering whether COVID is a mild illness, I think long COVID is one of the reasons why you should get vaccinated. And I think if you have vitamin deficiencies, so a lot of us have vitamin D deficiencies, for example, correcting those sort of deficiencies would also be prudent, given the fact that every small bit probably counts.
Right, it's very clear, very comprehensive. Thank you so much for joining us, Doctor. Dr. Lancelot Pinto from Hinduja Hospital in Mumbai.
Thank you.